Hi, my name is Susan Romann, and I'm planning to speak about promoting innovation and change utilizing advanced practice nurses. According to the National Health Service Institute for Innovation and Improvement, innovation is defined as doing things differently or doing different things to achieve large gains in performance. Change is defined as making someone or something different or to become something else. Advanced practice nurses as change agents. The 18 nurses are master's degree prepared registered nurses that have achieved an expert knowledge base. They have strong skills for decision making and have developed skills and competence to perform an advanced level of care. These nurses can institute change and innovation by following change and innovation theories. There are many theories for initiating change. I'll discuss three of these theories. They are Lewin's theory, Rogers' theory, and Lippitt's theory. Lewin's theory incorporates three stages to change, which are freezing, moving, and refreezing, to solve for a problem. He also utilizes a force field model to determine the best direction to follow to incorporate change. Rogers has 5 phases of planned change. These phases are awareness, which is becoming aware of a problem. Interest is defining the need for change. Evaluation, which is determining the best plans to begin the change. Trial is trialing the change. And adopting is adopting the idea. Lippitt's theory has 7 phases for change. These 7 phases are to diagnose the problem, to assess the motivation and capacity for change, to assess change agents' motivation and resources, select progressive change objective, choose appropriate role of the change agents, maintain the change, and termination of the help relationship. Innovation theories include organizational logic, which arranges a system, configures coherent thoughts. Diffusion of innovations explains why, how, and at what rate new ideas are spread through a culture. Disruptive innovation helps create a new market and value network to improve earlier technology, improve a product or service by creating a new set of consumers. Innovation and change occur in nursing daily, and these changes may lead to improvement in patient health and the healthcare systems the nurses are working for. Considerations for change and innovation implementation. There must be an alteration in the current practice. Human agency must be involved, which can be an individual, a group, or many groups. A time parameter should be set up as to when the change will occur and to the extent of the change. The level of change incorporates the number of people or groups involved in the change, the predictability of the change or innovation, and the degree to which the change can be orchestrated or planned. There are 4 drivers for change or innovation. These drivers are life cycle, which occurs in stages like the birth to death stages of life, teleological, which is based on social construction and goal formation, dialectical, which emphasizes discussion and action and incorporates thesis and antithesis, evolutionary, which is repetitive, varied innovations used to reach retention of the innovation. Development of clinical nurse leaders. The Institutes of Medicine report To Err is Human, Building a Safer Health System, reported on the cause of errors, that errors were more likely caused because of the dysfunction of the system and not the skills of the providers. This report called for a change in action for healthcare practices. The provision of healthcare has changed now with focus from treating disease to promoting health and well-being. The American Association of Colleges of Nursing has introduced a clinical nurse leader position approximately 30 years ago. The role of this clinical nurse leader will incorporate clinician, information manager, outcome manager, systems analyst, client advocate, risk anticipator, educator, team manager, and lifelong learner. Clinical nurse leader responsibilities include maintaining core competencies, which include clinical leadership, care environment management, and clinical outcomes management. Clinical leader responsibilities include change in performance culture by developing practicing guidelines, clinical pathways and databases for care guidelines, and reducing variations within clinical practice. Care environment management incorporates monitoring multidisciplinary teams' interactions to detect inconsistent care and to develop an improvement plan. The clinical outcomes management should incorporate a set of clinical guidelines that are measurable and prove the value of the clinical leader's interventions. These can include patient satisfaction, JACO, National Patient Safety Goals, unit-specific nursing performance improvement indicators, and patient satisfaction scores. Clinical nurse leader. The practice of the clinical nurse leader should be a specifically delineated position to achieve success. The leadership responsibilities are delineated into 4 core activities. They are facilitating effective ongoing communication, strengthening professional relationships, building and sustaining teams, supporting staff engagement. The clinical nurse leader is responsible for change in performance culture. These responsibilities include developing practice guidelines, creating clinical pathways, educating staff to maintain quality care. Theoretical framework. The theoretical framework used for clinical nurse leader positions will be based on Swanson-Kaufman's theory of caring. This theory is based on 5 core delivery processes. These processes include maintaining patient beliefs, knowing, being with the patient, doing for the patient, and enabling or informing the patient. This theory allows nurses to understand the necessary bridge between nursing outcomes and caring for a patient. The bridge incorporates patient family members, healthcare providers, and the nurse. This facilitates understanding we touch a patient's life only through caring, and leads to the belief caring about a patient is as important as caring for that patient. Theoretical framework continued. Focus of the framework: nurse caring to create trust and build relationships. Swanson-Kaufman's beliefs are maintaining belief is the faith that others can transition through an adverse event. A knowing is trying to understand the meaning from someone else's perspective. Being means with emotional presence. Doing for connects the nurse to the patient. The nurse does what the patient is unable to do. And enabling facilitates a transition through the unfamiliar life event. Interventions to promote clinical leader effectiveness would include instituting an educational program to encourage all master's degree prepared nurses to become clinical nurse leaders and use their expertise to become an educator, a patient advocate, build working relationships with nursing staff and physicians, encourage team building exercises for the staff and the clinical nurse leader to develop common goals for patient care, encourage staff in the caregiving process, and facilitating communication between the interdisciplinary team members to develop the best care plan and outcomes for the patients. The results of the interventions can be used to clarify team members' roles and responsibilities. We could determine effectiveness of interventions through patient satisfaction, reduction in length of patient stay, and staff satisfaction. Documenting successful interventions would be able to be kept to use for best practices and further develop best practices and to educate the staff. In conclusion, innovation and change are integral components of healthcare administration. The development of the clinical nurse leader position has fulfilled the need for collaborator, educator, patient advocate, outcome manager, and many more. This leaves staff more available to provide care for the patients. The clinical nurse leader is a resource for the interdisciplinary team. Utilizing clinical nurse leaders would be an asset for any treatment venue. Thank you very much for listening to my presentation.